It's not working. The economy, that is. That's basically what Fed Chairman Ben Bernanke said at last week's meeting of the Federal Open Market Committee. Bernanke made it clear that quantitative easing, as it's called, will continue, and confirmed that economic growth stopped toward the end of last year. NCPA Distinguished Fellow Bob McTeer, himself a former member of the Open Market Committee, told CNBC's Larry Kudlow the economic forecast may not be as bad as it looks. However,
over the past 3 years, the money supply, M2, has only grown about 7.5% to 8%. Velocity has come down about half that.
The turnover right?
Of money.
Yep.
And so you subtract the velocity from the money growth and you get your 4% nominal GDP growth.
Which is not a big number. Which is not an inflationist number.
One could make the case that the Fed's been a little tight.
Bernanke also said the Fed will keep interest rates suppressed until unemployment is 6.5% or lower. But Dr. McTeer noted that allowing interest rates to rise a bit would promote economic growth.
I just think the economy would be healthier if they do the reverse of that and allow interest rates to tick up a little bit, allocate capital a little more effectively, but using quantitative easing, not let the money supply shrink, keep it growing slowly.
McTeer also noted that he doesn't expect the Fed to change its policies as a result of last week's news. Meanwhile, as NCPA President John Goodman has long predicted, the bigger public policy problem than passing the Affordable Care Act, also known as Obamacare, would be its implementation. Now, even reliable administration supporters such as Big Labor have come out against portions of the act.
Obamacare was put together by a lot of special interests, and there was nobody making sure all the parts fit. And now we're finding all kinds of loopholes and problems. So the unions are going to have to pay more for their members, and they're going to compete against people that are going to get generous subsidies from the federal government. They don't like that.
How to solve our health care problems? NCPA Senior Fellow Devon Herrick told Dennis McQuestion's program on PBS that most health care dollars are paid to someone other than a doctor by someone other than a patient.
We never see a price, and we never see a price simply because we have insurance companies who are paying most of our bills. If we enter a doctor's office, about 90 cents of that bill is being paid for by a third party, by an insurance company, by Medicare, by Medicaid. And without prices, we can't make choices about what our preferences are. We can't comparison shop.
Herrick says we are at a crossroads in healthcare. One way lies more rising costs and more time spent waiting in doctors' offices and hospital waiting rooms. The other promises to contain costs and increase the quality of care.
I think the solution really would be to reconnect patients with the decisions they make. Instead of forcing people to buy health coverage they may not be able to afford, why not provide a uniform tax credit where each family can decide which policy they want?
And Steve Ivey, NCPA board member and chairman of the Audit Finance Committee, was featured on the local PBS program CEO to talk about his business, Heritage Auction Galleries.
Overall, in what one would consider the typical collectible areas, we're actually bigger than Sotheby's and Christie's.
For more information about these important issues and the NCPA, please contact us. You can call us or send us an email. We want to know what you think. And thanks for your support of the NCPA and the important work we're doing.